They weren't just chasing a rank, they stayed steady when it got hard. They breathed through the doubt. They rested, recharged, and rose. They kept their vitals intact. Today, they don't just rank, they embody the rhythm of resilience.
Yeah, now we are live.
Yes, sir.
So it's a great day. It's a great day. Yesterday was a great day. We had
Yes, sir.
lots of success stories to hear. And right now I am with Dr. Yashika Agarwal, and she has secured rank, all India rank 86, 86. And that's a tremendous, marvelous result. And on behalf of whole DBMCI family, we congratulate you for such a grand success, and we congratulate your family members too. So you have made us proud. And yes, this short interview session will be like a guiding path. It will be enlightening and inspiring for all the aspirants who are going to write future exams. So just tell about yourself, Dr. Yashika, from where you did your MBBS and how you started your preparation journey.
So basically, I'm from Lady Harding Medical College, 2019 batch, and I started my preparation mainly in the later part of first year itself, like when the COVID arise, when we are sitting at home. So at that point of time, I joined DBMCI and I started my preparation from very first year.
Okay. So you started your journey the way the time you entered your MBBS curriculum, isn't it?
Yes, sir. Yes, sir.
Okay. So you are our proud DBMCI face-to-face Delhi Center student,
Yes, sir.
and every faculty knows you very well. You have been a top performer in all the class-wise tests. After the subject is completed, you get a class test. You have been doing wonders. You have been topping, and I have given you, I think, some awards also in one of the test and
Yes, sir.
discussion.
Yes,
Okay.
sir.
So we will be starting the interview with few basic questions, which will be like helpful for all the aspirants. Like,
Yes,
what
sir.
was your schedule like? How, मतलब कैसे schedule बनाते थे? Day wise schedule.
Sir, for example, if I'm going for a class, like it's an FMT class. So once the FMT class is done, so I go back to home and I'll revise what I've studied in the class. So by daily revising that subject, it create a basic concept of that subject. Ki, yes, I know all this about the subject. After completing the subject, I used to give the test so that I should know ki, what are my weak points. So during the like second and third year, when I was going for the live classes, that at that point of time, I completed all my 19 subjects notes and I gave the subject by test. In final year, I gave the TND of all the subjects. I used to complete my subject in the week it was scheduled, and at the end of the week, there was a test. So I used to give the TND. And at the time of internship, I also rejoined the TND batch in Bhatia itself. And at that point of time, also, I used to give the daily, weekly TND test and preparing for the subject itself.
अच्छा एक चीज बताओ. Like, how did you keep your preparation steady so that it should not fall behind? You should not fall behind.
सर
Steadiness कैसे
डेली
ला?
मतलब डेली मोटिवेशंस तो मुझे लगता है मेनली टीचर से ही आता था व्हेन यू गेट दैट अप्रिसिएशन फ्रॉम योर टीचर्स यार यू आर डूइंग गुड यू आर डूइंग गुड यू कैन डू वेल आल्सो so when you used to say me ki you are a under 100 rank student for me so that give a boost to me yes I can do it I can very well do it and I have to do it so the daily motivation coming from my teacher from my parents also कि ठीक है मुझे पता है तू कर लेगी so that bring a steadiness to my preparation ki yes I can do it and I have to do it.
Okay. एक fixed class schedule. How do you feel that a fixed class schedule or daily targets is it helpful to maintain the rhythm of a student?
Yes sir, it is very important because अगर हमको पता होता है कि इस वीक में हमको ये सब्जेक्ट्स खत्म करना है ये मेरे टारगेट्स हैं तो it will be very much able to finish on time. Until unless if I don't know कि I have to finish this subjects तो I will like चलो ठीक है हो जाएगा. कभी कभी ऐसा होता था कि ठीक है अभी इस वीक दिवाली आने वाली है तो कुछ पढ़ने को नहीं है तो इट सीम्स लाइक पूरा वीक वेस्ट चला गया बट व्हेन यू हैव अ फिक्स शेड्यूल so it help you like gearing up your preparation finishing your targets on time So it's very much important to have a fixed target. If you don't have fixed target, you won't be able to make it.
Okay, so to summarize, the scheduled live classes and the proper, regular, defined structure helped you to be in the pace, isn't it?
Yes, sir. Yes, sir.
And that is what is called discipline. You have to be disciplined.
Yes, sir.
And actually, the
Yes, sir.
classes, when they are scheduled, now, they create that discipline within. And that is
Yes,
very,
sir. When you know you have the class on the other day, you are very much prepared. Ki I have to read about this topic. I have to know something about this topic. So that create a rhythm.
okay. There is one query in the mind of many aspirants. Ki, sir, I have learned the concepts, but I'm not able to apply them in the form of questions. How did you manage that?
So, मतलब, starting में when I am studying also, I also won't be able to apply that concept, but it came with the practice. Like I am doing question daily on daily basis. If I don't able to apply now, I will be able to apply on some other day. So keep practicing. Otherwise, you won't be able to make it up. अगर मैंने आज किया है, आज नहीं हो रहा है, then I'll revise the topic again. I'll get my concepts clear and I'll reapply it on other day. So I have seen the improvement in myself. If I'm getting like 120 score and on another day I'm able to learn some concepts, I am clear it on the very day and I'm improving from 120 to 140. So keep practicing. You'll able to learn from practice itself.
One direct question. How many MCQs
Yes.
did you solve daily?
Sir, I used to solve 100 minimum, मतलब maximum तो फिर कितना भी हो जाता था, but
That was
minimum
like the
100 a target.
benchmark 100 questions daily.
Yes, sir.
Wonderful, wonderful. And your result speaks about your hard work. Solving
Yes,
100
sir.
questions at least daily is like maintaining the consistency, and you have proved that with consistency
Yes, sir.
anything can be achieved. Very good, very
Yes,
good.
sir.
So, did you have a fixed ratio of watching the videos or learning the concepts or revising your notes? And with MCQ practice, was there any fixed ratio?
Yes, sir. Matlab, I used to divide, like I used to study 6 to 8 hours daily. So I used to divide this time like 3:1. 3 hour I'll study, 1 hour I recall, not passively by seeing the note, I'll revise actively and do the MCQ. Then again 3 hour I'll study and 1 hour I'll do the active recall and MCQ. So I used to study like this.
This is one of the best strategies which every aspirant should adopt. Should
Yes, sir.
adopt. Okay. How was solving questions alongside theory? Did it change the way you approached different subjects, all the 19 subjects?
Yes, sir. Like when you solve the question, you came to know about the silly mistakes that we used to done in our exams. So by solving MCQ, first thing you go to know about your silly mistake. Second thing, sometimes when you're reading your notes, you skip something कि चलो ठीक है ये important नहीं है. But when you solve the question, you came to know कि नहीं, it's a PYQ, it's a very important topic. You have to go in depth of this topic. So it gives the two aspects. First, you know about the PYQ, the important aspects, and second thing, you know about your silly mistakes. Then you don't have to do this again. So it help you create a fundamental difference. Ki you won't do the silly mistake the other people are doing, and you came to know ki you can predict basically ki question can be asked from this topic.
Okay. So, like once you are solving one MCQ of one subject,
Yes,
let us suppose,
yes.
were you able to integrate the topics across different subjects?
Yes, sir. Like I have done integrated study. Like the idea came from you only, sir. You gave me that you should do the integrated study. So I integrate subjects like physiology, biochemistry, pathology, pharmacology, medicine. So I used to do integrated study. That helped me give a very much like upper hand in solving the systemic wise approach. कि फिजियोलॉजी का क्वेश्चन है, मेडिसिन से कुछ थ्योरी दिया है और ड्रग पूछा है. So that integrated approach helped me a lot in solving the MCQ that many people are doing wrong, but I'm doing correct. So that idea came from you only, sir. You gave me that you should do the system-wise
Correct.
study. So that's a wonderful idea, sir. That helped me a lot.
Actually, every aspirant should approach system-wise studies based on the intensity of the questions in the actual exam hall. Nowadays,
Yes,
what
sir.
they are doing, along with the concepts, they are also focusing on the English language, the grammar part of the
Yes, sir.
question. It was so tricky, framed in a tricky way that if your English is not sound, you might not comprehend the question correctly.
Yes,
So
sir.
by solving the questions in an integrated way. So, you solve the questions from which sources?
So I used to use the Marrow and the DBMCI Live One app to solve
So
basically
the
I used to make the custom
Marrow
modules.
actually has got custom modules, system-wise custom
Yes, sir.
modules. That is wonderful,
Yes, sir.
wonderful. And many students have actually given very good results with the help
Yes,
of
sir.
practicing those questions.
Yes, sir.
And that was the advice which I gave you.
Yes, sir. That helped me a lot.
Okay. So, after reading the videos, after analyzing yourself, your silly mistakes, once all this is complete, how did you reset your knowledge with a last minute revision is like comprehensive? It's going to be very bulky. How did you minimize that?
So I have made a 20th notebook, the choti copy types. जिसमें I have written all the stuffs like I'm forgetting, I've done the silly mistake. Yeah, this is the very important topic. So I've compiled all in a single notebook. It's like 40, 50 page notebooks that I revise in last 2 days before giving the exam. And that is very much doable. You revise the important stuff, you revise the PYTs, you revise the silly mistakes you have done, so that is very much helpful. You compile because at the last week you can't revise the whole stuff. So you should have something that you can revise in your last days. So I have made a something like compiled kind of thing, the 20th notebook. So I revised that notebook in my last 2 days. And that
Every
helped me a lot.
aspirant,
There was
every
many question in the paper that arrived from my 20th notebook.
every aspirant should adopt this technique. This is
Yes,
wonderful
sir.
technique. And this I've been telling in all my classes, and almost everyone tells. All the faculties they tell about this approach that you should have something which is revisable in the end moment. So now
Yes, sir.
coming to this aspect, did you attend one shot? One of the leading questions.
Yes,
Answer
sir.
is
I
between
attended.
yes or no. So
I
yes,
attended, but I attended
was
after
it
completing my
beneficial?
first revision. Yes, sir, it was very much beneficial. I attended like in February, in 2025, in February, after completing my first revision. At that point of time, I've completed my first revision. And after that, I saw one shot, and it was very much helpful. I was able to revise like 19 subject in a very crisp manner. So it was very much helpful.
It's like a pre-cooked cake for you, and we are
Yes,
putting
sir.
cherry on the cake. Just
Yeah,
have the
yes,
cake.
sir. It's a cherry on a cake. Really like, sir. It's a cherry on a cake.
The cake has been prepared by student by making the notes, and cherry is like DBMCI one shot. Okay, very good.
Yes, sir.
So एक चीज बताओ कि you also enrolled in the test and discussion program. How was
Yes, sir.
that helpful for you?
I think the fundamental data is created by DBMCI giving the T&A is very much helpful. Like studying for 2 years in second, third year, preparing the notes of 19 subjects and just revising won't be much helpful if you are not giving the test. So in final year, when I was attending the TND, I realized how to like go through my preparation. It will tell you ki how you have to study, basically what topics are important, how what should be the approach of studying of taking a subjects, and very much new things like अगर कोई new updates आया तो वो भी आपको TND के through पता चलता है. So TND, I think the best part of your preparation is TND. If you are giving a TND, you are far ahead of many students. So I think my good point is I have done TNDs in final year. That helped me a lot. That make me going easy in my internship because I know that how questions are framed from these topics.
And along with that, you had already in your backend the system-wise approach. The
Yes,
actual
sir.
MCQs which come in the exams are like maximum MCQs are system-wise.
Yes, sir.
Okay. So now coming to a general question, who is your favorite faculty and why?
So I think I have lot many favorite faculties. I'll give year wise, like first year,
Yeah,
second year, third year, fourth.
that will be wonderful.
In first year, I'm a big fan of Ashwini sir. I'll tell you my in first year, my favorite subject was anatomy. And I don't know, matlab, when we entered in the MBBS, we used to study by ourselves only. We don't have so many apps, or we don't know much about the teachers. So in COVID time, when I joined Bhatia, I came to know about Ashwini sir. तो आशीष सर टोल्ड मी कि अश्विनी सर का लाइव क्लास हो रहा है तो आप वो अटेंड करके देख सकते हो. इट्स अ कॉम्प्लीमेंट्री टू यू. तो आई वाज लाइक चलो ठीक है, रिवाइज ही हो जाएगा, एनाटॉमी तो मुझे आती है वैसे भी. तो आई joined अश्विनी सर क्लास एंड इट वाज लाइक सर फर्स्ट taught us head and neck. So head and neck was little bit weaker section for me. So when I saw the class of sir, I was like, मतलब क्या बनाया भगवान ने इनको. It was so great. So I was like, मतलब
Okay.
anatomy पढ़ना इतना fun भी हो सकता था. मतलब I was so astonished by seeing Ashwini sir. I'm a big fan of him.
Ashwani sir actually dissects anatomy in the most simple way, which a
Yes,
student
sir.
can grasp very easily. He is like
It was great.
he is one of the greatest teachers. Correct. Now coming to other years.
Second year में तो I'll say Praveen sir, Nasir sir, all are like words are less for them.
They are
I'm a
like
big
gems.
fan of, yeah, they are like gem. Praveen sir, Nasir sir, I'm a big fan of both of them. मतलब Nasir sir, like the way he taught us microbiology, I think nobody can taught us. But I used to like in my second year when we used to have like short discussion, my teacher used to say कि तू कहाँ से पढ़कर आती है तुझे इतना माइक्रो याद कैसे रहता है.
अब कैसे
So I was
रहता है?
like मैं नासिर सर के पढ़ के आती हूँ वो सब याद करा देते हैं. So I'm a big fan of Nasir sir. The way he taught the microbiology, like I need not to revise microbiology. I can answer any question of microbiology sitting right here. All. I have that much confidence in microbiology. So he
Wonderful.
was great. And Praveen sir is like the fundamental, the base he has created for us. Like we used to skip much topics in medicine because we know कि Praveen sir ने इतना पढ़ा दिया है कि हमें पढ़ने की जरूरत नहीं. So he's also really a gem.
Coming to other years.
In third year, obviously, sir, forensic medicine. You, मतलब, your notes are revisable like within 3 and 4 hours only. यू टोट मैं तो मतलब अपने कॉलेज में जाके बच्चों को बोलती थी पीपल यूज टू सफर अबाउट कि अरे यार फोरेंसिक याद नहीं होती है मैंने कहा तुम्हें फोरेंसिक याद कैसे नहीं होती तुम विश्वजीत सर के लेक्चर देखो आई हैव रिकमेंडेड सो मेनी पीपल टू वॉच योर लेक्चर्स फॉर फोरेंसिक मेडिसिन आई वाज लाइक इट इज रिवाइजेबल विद इन 3 to 4 hours एंड व्हेन दे सो योर लेक्चर्स दे बी लाइक कि यार सर है तो मस्त क्रेजी पढ़ाते हैं सर.
Thankful for the gratitude. Thankful. आगे बढ़ो.
Rajiv Shetty sir from PSM. I basically not attended his classes, but I have attended his TND. And after attending his TND in final year, I was like, I should have watched the PSM from his classes. He's a great mentor also. He's a great teacher and is a great mentor also.
Yes.
So in PSM, I would recommend people to see his lectures. He's a great teacher. And in final year, I would say Jay Arora sir for surgery. My favorite subject in final year is surgery, and he has created a great foundation for us. Like the way he give the flow charts, the way he clear all our doubts, and the way he teach is great. And no need to mention about Thamim sir. He's already a gem. And
चलो.
Sakshira ma'am for Obs Gynae sir.
Okay. Okay. So now coming to one very basic question. Like every aspirant will feel the pinch next year also. So just let the audience know that when did you start your revision?
Like I started my revision in final year itself because I have all the 19 subjects notes ready. So I started my revision in final year only. I gave all the TNDs of 19 subjects. So I had my first revision in final year. Then I started another like revising again in my internship during my internship. So I started like at the starting of internship, it was very tough to study because it take time to get settled in that environment that you have to work and you have to study also. So I started revising during my internship like around June or July. Then I completed my first revision around mid November or December. Then I started my second revision round. I have done 3 revision before my INI.
Before your INI. Okay.
Yes.
So now coming to one very important question for all the aspirants. Like there are many students who have not scored good ranks as per their
Yes.
expectation. So what is your sincere advice to those people?
I would suggest first कि after seeing your result, you would have surely came to know about कि what gone wrong during the exam. Like I have got call from my friends ki I did silly mistakes. I did this in the very exam day that I don't used to do before. Like जीटीज में पहले अच्छा करे थे बट एग्जाम के दिन कुछ अलग ही अप्रोच यूज कर लिया तो आई थिंक दैट on exam day take it just as an another gt, don't do much experiment on that day, do do follow the approach you are using on the normal days. And secondly, evaluate your mistakes. Ki what gone wrong on the exam day? Ki have you done more silly mistakes? Have you done like become like over cautious? You have not seen the note in the question, expecting the questions. So see all those mistakes. Evaluate yourself. Then you will make to able to correct your mistakes. That will help you to improve your score also.
Improve your score also. Okay, what was the frequency of GTs which you have been given, grand tests?
Sir, in like my first during my first like I've given my first GT after final year. I've told you also I got a 120 marks after
I
giving
your
my
marks GT wise 135, 150, 155. I've seen your
yes sir.
improvement day by day.
Yes, sir. So I got 120 marks in my first GT. Then in internship, I give GT after completing my first revision. I give my second GT and I get 135 marks in my second GT. Then I in my second revision round, I give GT 2 weekly. Like after 2 weeks, I used to give GT. Then I scored 150. I scored 155. I scored 160. I scored 164, 168, 170, 174. Then it keep improving.
Then it kept improving. So
Yes,
gradual
sir.
improvement is what is needed. You should not get
Yes, sir.
worried about the marks of GTs, that my mark is 135 and I am not a good student. There is
No, sir. It will keep.
always scope of improvement.
Yes, sir. Like I also texted you when I was stuck between 155 to 160. I was not able to improve beyond 160. So you will like keep revising, keep looking for your mistake, and you will improve. Then after that, I'll improve. After two GTs, I scored 158, 158, 160. Then I scored 165, 160. Then it keep improving. It can be stagnant for some times, but you have to keep working on yourself, and it will improve. For sure, it will improve.
And my suggestion will be, like, if you are not doing good in GTs and if you are worried, like you are also worried at one point of time of your preparation,
Yes, sir.
you
Yes,
texted
sir.
me and we had a good talk, and that kept you in momentum. So you should talk to
Yes, sir.
people that how
Yes,
I
sir.
can improvise, what are the scope of improvements. You should always talk rather than fitting your mind with anxiety and depression. So you should not be
Yes,
under
sir.
stress factor. उसको रिलीज करना है, उसको रिलीज करना है बात करके। टीचर से बात करो, पेरेंट्स से बात करो, दोस्तों से बात करो, फ्रेंड से बात करो, जिसमें भी तुम्हें विश्वास है। Whosoever you believe now, you should have a good talk and you should improve yourself.
Yes, sir. Like in, I would like to mention that in August time when I texted you, ki sir, I'm very much in depression. I'm very much anxious. I don't know what to do. It's not going well. And at that point of time, what you have done for me is like I can't express in words. The way you guided me, the way you supported me, ki Yashika, you can do it. You have to follow this part. Text me when you are worried. Complete your daily target. Finish your first revision by November. That helped me a lot. I think you should have a mentor, you should have a friend, or you should have someone to talk about when you are feeling low. It will help you really. It will help you a lot.
And it's human nature to feel low. You will be someday very high. So it's like human nature. There is nothing wrong
Yes,
in
sir.
it. You are feeling low. You should just curtail it as soon as possible.
Yes.
And you curtailed
Yes,
it at the right time.
yes, sir.
Okay. So it was nice talking to you, Dr. Yashika. And yes, you have made us proud. And again, on behalf of whole DBMCI family, we congratulate you for your grand success, and to your family members. God bless you, and you'll do wonders in your futures also, in your future exams too. Like you'll be doing
Thank you so
super
much, sir.
specialization or whatever. You'll do good in life, and always keep that smile on your face.
Thank you so much, sir.
Okay. Okay. So bye bye.
Thank you, sir.
The journey doesn't end here. Keep your rhythm. Hold your balance. Breathe. Reset. Rise.